Hi, I'm Chris Lee, and this is Virtually Speaking. Joining us again today is Dr. Stephen Klasko, who first joined us in our first episode of Virtually Speaking. I'm excited to talk to him about the progress they're making with the pandemic, with the vaccine, and also what healthcare looks like today. He's the president and CEO of Thomas Jefferson University and Jefferson Health since 2013, one of the nation's fastest growing academic health institutions, where under his leadership and his vision of reimagining healthcare, Jefferson Health has expanded from 3 hospitals to 14, employing over 35,000 people. And they've been one of the very best at protecting their staff and their physicians with a less than 1% rate of infection of COVID, where the nation's average is at 3 to 4%. His track record of success at creating and implementing programs that are shaping the future of healthcare earned him a place among Fast Company's 100 most creative people in business in 2018. He's also ranked number 2 on Modern Healthcare's list of most influential people in healthcare. And for 2018-19, U.S. News and World Report has ranked Thomas Jefferson University Hospital among the nation's best in 10 specialties. In 2020, he was named the first Distinguished Fellow of the World Economic Forum. And in 2020, he published 2 books, Unhealthcare, From Sick Care to Health Assurance, and Patient No Longer, Why Healthcare Must Deliver the Care Experience that Consumers Want and Expect. His best-selling 2018 book is titled Bless This Mess, A Picture Story of Healthcare in America. So please join me now with the incomparable Dr. Stephen Klasko. Well, hello, Stephen Klasko. Welcome back to Virtually Speaking. How are you doing, sir?
Chris, it was a very different world when last we spoke, but it's great to be back with you.
Indeed. And you were my first episode of this entire series. This is 32 episodes, 33 episodes now, and so excited to have you back. It was amazing speaking to you then, and now we're like 9 months, down the line here, maybe 10 months. I'm not sure exactly, but obviously a lot of the things you said were going to happen have basically happened, and a lot of things that we didn't know, we know. So obviously I'm very excited to talk to you for 2 different reasons. One is you're obviously the CEO of 14 going on 17, 18 hospitals later this year, I've heard. But 14 hospitals now, which is 35,000 employees, and that also includes Jefferson University. And I know you still have a really good track record, which is great. You even had it just a few months into the pandemic, but you still have one of the best track records with your own employees and your own doctors, with one of the lowest COVID transmission rates amongst your employees. Is that correct?
Yeah, we had less than 1%, and the national average is about 3 or 4%. And look, it's interesting, Chris, because we were sort of right in the middle of the trifecta. If you were a university president, you had a really tough year because, I'm the president of a university. We were one of 3 places that actually kept kids in school without going totally online.
Wow.
If you ran a large health system, boy, that was really tough. And we're the largest health system in Philadelphia. Oh, and by the way, if you're a large employer, that was really tough. Well, we're the 2nd largest employer in Philadelphia. So we had the trifecta of being a large employer, a university, and a large health system. And by the way, right in the middle of not just the COVID pandemic and the financial tsunami, but we're right in the middle of the heart of Philadelphia and all the reawakening of racial tensions and racial inequities. So it's been a incredibly challenging year. But one of the things that's interesting, Chris, and we talked about this in your first podcast, when we had changed our mission from, we're going to be the premier academic medical center in Philadelphia, which nobody cares about other than you and your mother, to we improve lives, we really lived that. I mean, so, we were one of the only places in the country that did no layoffs and no furloughs of our 32,000 employees. Not one person got furloughed, not one person got laid off. Well, but I said, boy, that was really stupid because you obviously lost more money by doing that. There were some people staying at home. But now that we're on the rebound, both the morale and the numbers of employees we have are ready to rebound. We made absolutely no compromises in PPE. So just to give you an example, gowns went up from 12 cents to $11 a gallon. We use 15,000 gallons a day.
So
So I'm
that
sure,
happened from the beginning of the pandemic to now, the
yeah,
price
well, from
change?
about March to September. So,
That's
and
absolutely ridiculous.
yeah, and I'm sure you've read, people with trash bags. We didn't change our gown policy at all. It was single gown, single case, et cetera. So that probably
Wow.
cost us just that $50 million. So I think what we're proud of is it's not like, oh yeah, we got lucky and we had this incredibly low employee infectivity rate. We really said if our job is to improve lives, then how are we going to do that? And we'll figure out the financial ramifications and some of the other ramifications later.
That's amazing, man. Kudos to you for doing that. That's awesome. And I was saying there's really two reasons why I'm excited. The other reason I'm excited, and I really want to get into right now and today's, news and the latest and greatest with the pandemic and the vaccines and the cures, the treatments and everything. But I also am excited always to talk to you because you're I mean, I kind of in my mind think of you as the Steve Jobs of healthcare. I think of you as one of the most innovative, and a lot of people agree with me and have kind of told me this as well, that you're one of the greatest minds in healthcare as far as how do we use technology, where are we going, how is this all changing from really sick care to care at home and care of ourselves through so many great technologies. So I'm excited to get into that part as well, which I know you are super excited about. But obviously, there's some burning questions that I have for you. Of course, again, you run hospitals and you've been in the middle of this whole thing. So you know so much more than most because you're doing it and you're in it. So one of my questions is, obviously, and you're one of the people in the world, not you yourself, but your team is working on a vaccine yourselves based on, I know it's a rabies vaccine. It's in India that you're doing this, and it's adding to that, and it actually works, it looks like, and it's going to be something that you use in the developing world as a vaccine, which is phenomenal, and it'll be just as effective, I think, as the others from what I've read and what I've heard. But that's exciting. I want to know about the United States right now. I want to know about the vaccines right now. And, I don't think we all know the answers to everything. So one of the questions I had was this vaccine, they say, is either 90 or 95 or 97% effective, depending on which vaccine you get. So if somebody takes the vaccine, now we're starting to see our friends take it. Now we're starting to see people we know actually take the vaccine. One person I'm good friends with says she's never felt better since the beginning of the pandemic, feeling incredibly well between the first and the second shot. But so if somebody gets the vaccine and they get on a plane, but then if they are exposed to the virus, the vaccine doesn't keep them from getting the virus. It just keeps them from getting affected by it, right? So can they still carry the virus even though they're vaccinated and then pass it on? Because I'm worried that a lot of people are going to say, oh, well, my grandmother or my grandfather are vaccinated. I can hang out with them. I can't give it to them. They can't give it to me. But is that true?
Yeah, so I'll tell you what I tell everybody on any news show that I do. First of all, anybody that tells you anything about the future of COVID or the vaccine says, I know, don't listen to them.
Right.
So I always start with, I don't know, but I probably
Right.
know a little bit more than a lot of people in your audience.
Right.
So let's just get some facts. So first of all, right now, the two approved vaccines are Pfizer and Moderna. They are what's called messenger RNA vaccines. They, in essence, trick your immune system to respond to COVID.
They don't give you the actual COVID
Right,
virus.
exactly.
Right.
That's exactly right, Chris. So the next one that will be out probably, in mid-February is the Johnson & Johnson vaccine. That's much more like your traditional flu vaccine. It's an inactivated virus, that basically, again, acts like the virus and your body gets antibodies to it. The answer to, so the two questions I get asked a lot are, so how long am I immunized for? And the answer is we don't really know, because think about this, all these clinical trials have only been 6 or 7 months. The second question is, how do I know, 2 years from now, my left little toe won't fall off, and the answer is sort of, well, we don't think it will, but also we've only done trials for 6 or 7 months. And
Right.
So the safety is there. The question you asked is a really smart one and a really good one. And no, it does not mean that you are Superman or Superwoman, that you can't get it or give it. Um, what will happen probably for, quite a while after this is that you'll still need to wear a mask. If you go on a plane, it's not
Right.
going to be, oh, you're vaccinated, so you can be really cool and kiss people. No, it's going to be your chances of getting it are minimal, and probably your chances of transmitting it are less. But the simple fact is that we will be doing masks for a while. And if you look at the pandemic of 1918, it was really the pandemic of 1918, 1919, and 1920. It was called the pandemic of 1918.
Right.
Because they didn't have the kind of vaccines that we had, but they got herd immunity just by pretty much everybody didn't die getting it. Different way of getting herd immunity. One of the interesting historical things, by the way, because we've spent a lot of time thinking about the post-traumatic pandemic syndrome, and
Yeah.
especially young folks, how they're going to react to that lack of social, isolation. If you remember what we always talk about, the Roaring Twenties,
Yeah.
people don't recognize the Roaring Twenties were a direct result of the pandemic of 1918, 1919,
Yeah.
1920. Because just like now, people that were single weren't dating, and people, so different technology and that kind of thing. But I think a lot of us think that it'll be a pretty wild time early into the 22, 23 when we are less. I think what we're working on at Jefferson, and you'll start to see more of it, as we vaccinated about 50,000 people. And we now have a model where we can digitally give you a vaccine passport.
Nice.
So what I think you'll start to see is, oh, you want to go to the Philadelphia Eagles game, I need to see your ticket, and I need to see your digital transport, vaccine transport.
Right. So, wow, that's pretty cool. And it sounds like hanging out with somebody who's vaccinated really doesn't mean that you're not going to get it from them, and it's actually a little bit concerning, because it sounds to me like people who get vaccinated are going to be a little bit more willing to get on a plane, a little bit more willing to hang out in places they were not going to hang out before, because they know they've got a much lower chance of getting it. But because of that willingness to go in public on a plane or in a store or wherever it is, they still can get it and give it to somebody else, but just not be affected by it. So that's
I look at it differently a little bit. I think everything is a risk benefit, Chris, and we got to get back to a normal life.
right.
So I think the fact is, I want people to go on planes. Now, I want them to go on planes and wear a mask. I still travel quite a bit, and
Right.
right now I wear a mask and a face shield. An N95 mask and a face shield. I think once I'm vaccinated, I'll probably just wear a regular mask.
Okay.
I want families to get together next Thanksgiving.
Yeah.
And it's a whole different ball game if you're getting together with your family next Thanksgiving, when you've all been vaccinated, than it was this last Thanksgiving. Now, again, I would still, when you're not eating or whatever, wear a mask probably even this Thanksgiving, if you're together with a lot of people. But I do think we have to reopen restaurants, we have to reopen social gatherings, we certainly have to reopen schools, and having most of the population, everybody vaccinated, is going to give people a level of confidence, not cockiness, but confidence.
Right.
And I think that to me, that's the difference.
Another thing that's going to give people confidence is going to be the antibody test, which I assume is just getting more accurate and more clear as we go on. Is that true? I mean, do some of us get it? We just don't know it, and eventually we're going to find out, hey, we have the antibodies, so that's a good thing.
Yeah, a lot of folks. But even if you've gotten it and you get the antibodies, I would still get the vaccine.
Right.
Because at the end of the day, a lot of this is what we don't know is if you got it, how long do you have antibodies for?
Right.
We think that with the Pfizer Moderna vaccine, you're protected for at least a year. So that's what but we don't really know if you got a mild case of COVID and you have antibodies. If it was mild, does that mean your antibodies are milder? I mean, those are all things we don't really know. So we've advised everybody to get a vaccine, whether they've had COVID or not.
Right. And so, is the antibody test more readily available and more accurate now than it was 6 months ago?
And I think that'll become a little less relevant once we get most of the folks immunized.
Okay.
I think one of the things, it's a little bit like everybody talks about, when we went to the moon, NASA created some things like Tang, right? That's always been, I think the COVID thing has has created some stuff like we're getting involved in some companies that are now doing a lot of blood tests at home.
Yeah.
And the COVID test at home type thing has created some technology that I believe, I guess the best way to look at it is almost Theranos done right. And the concept of you having at home a little thing that you could take some of your own blood, stick it in it, and see how you're doing. I think it's becoming more and more a reality. And some of that came out of the COVID technology, just like the acceleration of telehealth, has come out of this. So I do think that one of the things, as with any crisis, will be what technologies were developed in bioprocessing or in virtual health or connected care or in some of these getting things closer to home that will accelerate some of the things that I talked about in your first podcast when I talked about healthcare at any address being something we wanted to push.
Absolutely. And then this is naturally transitioning into segueing into, us talking about the future of healthcare. And kind of my last question about today's healthcare is, it sounds to me and it looks to me like the cures or the treatments for this are really getting much better. I mean, people are starting to learn better about how to treat people and when to put them on ventilators and stuff like that. So is that what's the latest with your health system, at least on what you guys have learned and what you're treating people with?
Yeah, I think the triple cocktail, if you will, it's sort of what President Trump got, but that's probably the thing that makes the most sense today: remdesivir, steroids, and monoclonal antibodies. And I think one of the things that we worry a little bit about is some of these variants that we're seeing out of UK and South Africa. The monoclonal antibodies are very specific.
Mm,
And while the vaccines might vaccinate you against them,
right.
if you get one of those variants, it's not clear that the monoclonal antibodies will be as effective. So that's one of those things that we're looking at. But we're so much further along. Look. I mean, I think one of the things that if you get past all the politics and all the horrendousness of what happened this year, what science has been able to do is really pretty amazing. I mean, Operation Warp Speed of getting rid of some of the regulations and getting a vaccine, a novel vaccine that's never been created before, together in 6 months and get it distributed. I think the biggest failure, and again, not to be political, but the biggest failure is that the government, frankly, is not prepared to run complex things. I think, at Jefferson, we have 10 counties in 2 states. And everyone has different regulations. And by the way, if I followed any of them, it's counter to what the federal government does. And
Wow.
I have a house in New Jersey, Florida, and Pennsylvania, and all 3 of them have incredibly different things.
Yeah.
And all 3 of those governors are talking about how brilliant they are, having done opposite things. So
Wow. Yeah.
I was on a cable news show. I said, the pandemic has proven that Bernie Sanders was 100% right about the problem, and the pandemic has proven that Bernie Sanders was 100% wrong about the solution. I think the pandemic has proven that, gosh, we have a sick care, fragmented, expensive, inequitable, and occasionally unsafe healthcare delivery system. So he gets an A for that. I think the pandemic has also proven, hey, let the federal and state governments get together and they'll run all of our healthcare. I don't think we want to do that after this vaccine distribution mess.
Yeah. And man, you are so amazing. When I read and I talk to you about all the things you've done and all the things that you are doing for the future, one of the things you're doing now when you speak, which I love, is you're really painting this picture for looking back 10 years. You're going to about 2030, and you're basically saying, this is where we're at now. If another pandemic comes up now in 2030, man, are we going to handle it so much better. We've learned so much. And our patients are so much better taken care of now and prepared now, as is the healthcare system. And the interesting thing is, you were predicting all of these technologies and you were planning on and investing in all of these technologies years ago. You were. And I know people were even calling you a little bit crazy because of how much money you were spending on telehealth and other things you were preparing your hospitals to be able to do with your patients. So you have the floor. Take it from there.
Well,
It's amazing what's going on now with you guys and some other people in the healthcare world, and where this is all headed. Tell us
Yeah,
all about
so you mentioned Steve Jobs. I had an opportunity to work with Apple back in
it. Yeah.
2007. I actually ran their first digital health conference. I mean, think about this, digital health in 2007.
Yeah.
And so I did steal a lot of Jefferson's sort of strategy from Steve. Steve talked about, if you think back pre-iPhone, 3% of the computer market, the stock was $15. That was 27 splits ago, right? I mean, I did not keep my options, or I probably wouldn't be there with you. But if you think about it, he talked about the old math of computers and operating systems,
Yeah.
and the new math of this digital lifestyle. And for the folks who worked at Apple, are you crazy? Our whole revenue is computers and operating systems. We could go from 3% of the computer market to 4% of the computer market if you invested more in the Mac. And what are you doing with this crazy stuff?
Mm-hmm.
So at Jefferson, when I got there in 2013, I talked about the old math of academics and clinical hospital care and the new math of innovation and strategic partnerships. And it was really the same mentality. All we are is a hospital and a university. Like what are you talking about?
Yeah.
So when I did invest $30 million in telehealth back in 2012, it was like, you're crazy. But I think the concept is what was a genius about Steve is thinking about what's going to be obvious 10 years from now and doing it today. So to your point, what we've developed is the pandemic of 2030.
Right.
And the pandemic of 2030 starts in Australia. And for about 30 seconds, people are worried. They're my age. Oh, God. Now we don't have to worry about it. Why? First of all, everybody has broadband because of the Broadband Act of 2025, when they made the Comcast of the world, literally make sure it was like electricity and plumbing. Everybody had broadband. So we didn't have to worry about underserved folks not being able to educate their kids or having telehealth. By the way, 80% of healthcare happens at home now. Your wearable is transmitting data. So when you're sleeping, if your temperature goes up, it automatically sends a note to your employer that you're not coming to work that day. And since you have all your lab tests at home, you automatically are getting yourself a COVID test. And when you go on to Alexa and say, hey, could you play the daily podcast? Alexa's saying, well, before we have that, you actually have this new variant of COVID. So it's early. Don't worry. I've already sent a note out to your drugstore. They're going to drone deliver the medication to your house. By the way, all this stuff is in development as we speak.
Yeah.
So what we did is we developed the pandemic of 2030. And oh, by the way, if you were psychologically traumatized thinking back to 2020, your bot psychiatrist at 2 o'clock in the morning would be happy to help you through it. So at the end of the day, 90% of your healthcare is at home. And the example I always like to use is 40 years ago, Chris, we would have been talking about you and I can't deposit our checks on the same Friday because banks were open from 9 to 4 and there would have been big lines. Well, we don't worry about that anymore. I mean, there's a variety of things that have happened that banking is now democratic and happens at home. Healthcare will get that to that point. So what we do with
Healthcare is the last major industry to really adapt these technologies where they're interfacing with their customers at home.
Yeah. But what's fascinating, and at Davos last year, the CEO of one of the big finance companies said, you know what, Steve, we're having a cup of coffee. He said, Steve, 30 years ago, the two sectors that escaped the consumer revolution were banking and healthcare. He then took a sip of his coffee, and said, now you're alone. Yeah. But what's interesting about it? Who transformed banking? It wasn't the Wells Fargos and the Bank of Americas. And it wasn't the digital transformation. What it was the banks were stuck in this 9 to 4, you have to come to the bank. Remember what happened is smaller entities started to create these banks and supermarkets. There wasn't the digital stuff on Saturday and Sunday. And everybody said, the big guy said, oh, who's going to go to the bank, Joe's Bank in the supermarket? Well, it turned out that the FDIC insured them just the way they did Wells Fargo and Bank of America. So once you had that explosion of convenience mattered, then everything else came into the fore. Same thing's going to happen in healthcare. Consumers are going to have their I'm mad as hell and I'm not going to take it anymore moment. Let me give you an example in my specialty. I'm an obstetrician.
Okay.
There's now technology that if you need what's called non-stress testing, checking out your baby 3 times a week, you can do it at home. Now think about a 28-year-old pregnant person. One of the things that people don't realize is we view everybody as a patient. 97% of people in Philadelphia are people who want to be able to thrive without health getting in the way. So a 28-year-old pregnant person does not view themselves as a patient. So she's going to go. Now, let me get this straight, Steve. You want me to come down to Jefferson 3 times a week, pay $35 to park, go to a place where there's a lot of sick people, get in an elevator. You're going to stick a monitor on me. I'm going to stare at the ceiling for 2 hours so some nurse can tell me my baby's okay. I happen to know there's this company out there that literally will send me the monitor. I can do it at home, watch Little Fires Everywhere, drink lemonade, and have somebody come on the screen and tell me I'm okay. Are you kidding me?
Yeah.
So I think that as you start, just like, the banks and supermarkets, originally the Wells Fargo's and the Bank of America said, well, that's crazy, but people went there. You're going to start to see that kind of thing happen. And we're already seeing that where people are ignoring the traditional healthcare ecosystem. The difference between Jefferson and maybe some others is I'm not fighting it. If you come to my office, you'll see we want to be a 196-year-old academic medical center thinking like a startup company.
Right.
So the book that I wrote with Hemant Taneja, who's the managing principal of General Catalyst, is called Unhealth Care, a manifesto for health assurance, a manifesto for moving healthcare from a sick care model from the hospital to a home model at home. Again, very similar to banking, retail. I don't want to be Sears and Pennies when Amazon comes in.
Right. So talk a little bit more about this, which I think is one of the most important points you make, which is that right now we're in the sick care model. And how is that going to transform? And talk a little bit about the technologies and what hospitals and the interaction between doctor and patient is going to be like. And it's already happening right now. This isn't 2020. This isn't 2030. This is actually happening right now with you guys.
So I'll give you one of the companies we talk about because we partnered with Hemant on this company. So Hemant was the initial investor in things like Airbnb, Warby Parker, and Stripe. And if you think about those 3 things, they were all things that democratize us, right? It's not the arcane way of getting, what it costs to go to a hotel. Used to be if you wanted to build a bigger, better hotel chain than Marriott, you had to spend billions of dollars to build bigger, better hotels.
Right.
Airbnb disconnected people. So he wrote a book called Unscaled, that the 20th century model of being bigger and better mass production things is gone to personalized, customized. He said, I want to do that with health. And that's where we partner. And what everybody says, which they always do, oh, you can't get into health, it's too complicated. So he started a company called Livongo, which we were initial partners in. Long story short, Livongo just sold to Teladoc for $18.4 billion with a B. And what all Livongo does is take diabetes, probably the most common chronic disease in this country, and say, you're not a patient. You're a person who wants to be able to thrive without diabetes getting in the way. Yeah, you're right. My doctor treats me like a patient. My doctor tells me to come to the office. My doctor tells me to come to the ER. My doctor tells me to come to the hospital. So that's what they did. They created an AI company that made it easier for patients to run their own diabetes and be viewed as normal and tell them when they really do need to go to the doctor. So part of what we talk about, it's what I really believe in, is we have to get away from this, I am the doctor and I am the boss to the patient being the boss.
And are you even sick enough to be in this office seeing me right now? Are you wasting my time?
Yeah. So my car, Chris, gets better care than I do. My car is in the garage. This is a true story. While I'm sleeping, it's monitoring itself. And I wake up in the morning, I turn it on, it says, Steve, while you were sleeping, my left front passenger tire got a little low. Before you go to Starbucks, could you go and fill it up? Okay?
Yeah.
In 2 weeks, I'm going to go for a physical. And my doctor's going to tell me on February 9th, Steve, your blood pressure is X, your EKG is Y, your calcium score is Z. So this is what I want you to do for the next 2 years. That's asinine. That's not 1990s, that's 1890s.
Yeah.
That hasn't changed. Oh, and by the way, just the term physical means, I'm going to spend an hour looking from here on down. Your brain and brain health. Oh, that's something else. That's you can go to the alternative health provider for that. So for us, it's Bernie Marcus, who's one of the founders of Home Depot, has invested a lot in Jefferson and this whole Marcus Center for Integrative Health, brain health, a holistic piece of literally, we want to look at you on an ongoing basis.
Right.
So the future, which isn't very far away, is going to be that I'm going to be sending continuous data out. AI will filter it. And at the point, so people will never die, for example, of atrial fibrillation. Because while I'm sleeping, if my heart rate goes up above 200, it's going to send out a signal, it's going to wake me up, and an ambulance will be on its way. We're
Right.
actually partnering with companies that do that today. We actually started a wearable. I merged my health science university with a design university.
Yeah.
Everybody thought that was nuts. Well, it turns out the design of the human experience in healthcare is actually pretty important. And one of our most successful financial things has been developing a carbonized hemp wearable that is now being developed by Nike and Under Armour and others to literally start that concept. Like your Apple Watch and your Oura Ring will be like, well, why would you have that? When you run,
Yeah.
your shirt will monitor your miles, will monitor your heart rate, will monitor all that. You don't need 4 different things. That'll be viewed like, remember the old car telephones that you had to
Right.
have 2 people carry them.
Well, you had the iPod, and then you had your phone, and now it's inside the phone.
So what'll happen is, part of what you're wearing will constantly monitor you.
So what are the things? What are the things that right now? And I know that you just said there's like 4 or 6 different things you can own that can monitor different things. But what are the things that we can monitor at home right now in 2021, and that also can help people with COVID? It's heart rate. What else is it?
Yeah, so I think the major things are, if you have diabetes, there's companies like Livongo. There are companies looking at serious mental illness and preventing readmissions by that again, that's now one of the big issues, Chris, huge issues, and this is an important piece, is what privacy are you willing to give up for these companies?
For the monitoring of how you are doing, yeah.
Right. So if you take the serious mental illness thing, let's say I have schizophrenia and I harm myself or harm somebody else, and I was in the hospital and now I'm on whatever medication. There are ways. Remember Minority Report, the movie where people could predict who was going. Well, there are ways that we can now predict, if you're willing to give us all your data of what you're doing on Facebook, whatever, people that are going to go off the deep end. Now they volunteer to do that. In places like Israel, where they actually monitor folks because of terrorism stuff and that kind of thing, they had a much better idea of what was going on with COVID. But here, for some good reasons, people don't trust Google.
Right.
So the key with a lot of this stuff, Chris, is going to be what amount of privacy are you willing to give up on your health? So I'm going to give you asked how you make a difference. We did a partnership with a company, one of Heyman's companies called Color, where we offered every one of our 30,000 employees full genomic testing.
Wow.
And prediction. Now, but what we promised them is that they would get the data. We wouldn't even give it to their doctor. They would have to give it to their doctor. And we certainly wouldn't use it for any research or anything like that.
Right.
There are 2 or 3 of our employees that found out. I'll give you the best example because I think it ended up on TV. Is it turns out this woman has a rare disorder that with too much exercise, she'll die.
Wow.
And her mom died and her grandmom died like in their 40s, and they never understood why.
Wow.
Explain. Well, it turns out she was about to train for a marathon.
Oh my gosh.
And that saved her life. And now she knows she had that genetic disorder. She tested all 3 of her kids, and it turns out one of them hasn't. But that's life-saving.
Yeah.
So the question becomes, how do you, and it's something I think about a lot, we created something called a Center for Responsible Innovation. How do you put ethics in the beginning of this? How do you make sure that if you're one of my patients, that I have access to your genomics, but that I'm not going to use it to, sell it, or it's not going to be hacked and that kind of thing. And that's, to me, that's the thing that we're spending the most amount of time on, making sure that AI, which can be good, bad, and ugly, stays good.
Yeah, but that stuff is some deeper stuff. But the truth is that a lot of people don't even know what their their sodium level is, or their sugar level is, or their blood pressure is as often as they should. And in the very near future, we're going to know this every day, all day long.
Yeah. So right. So the two things that'll happen is that you will be able to monitor most of the things that you need to monitor at home.
Right.
Again, and this is not science fiction. We are a couple months away from very commercial. In fact, they're out there now, doing COVID tests, but these commercial blood tests that will be able to measure your sodium, just like Livongo can make it easier for you to keep track of your diabetes and what to do with it. So you take that together with telehealth, and then you maybe bring it together with virtual voice assistants that are getting all of that and then giving you instructions. And then sending, and if you look at what CVS is doing, or you look at why Amazon bought PillPack, the concept of, you no longer having to go to the pharmacy,
Mhm.
but my temperature just went up. It looks like I have this. I'm going to do a blood test or a strep test at home, and I need this antibiotic. And I go to Alexa, please order this antibiotic. It comes to me that day. That's not science fiction.
Right.
Every one of those components exists today. And that's what we at Jefferson, if you walk into my office, you'll see that I have a vision, that we have a vision at Jefferson to meet the needs of patients as close to home as possible, the way they consume every other consumer good, right?
Right.
I mean, the day after Thanksgiving, you don't go to the crowded mall parking lot. You do it at home in your pajamas watching Game of Thrones. The key is to get health as close to that as possible.
It sounds like a lot of industries still have a lot to learn with this kind of thing, and in the major industry of healthcare is kind of the last major one to really start adapting this. But the pandemic, in a lot of ways, has rapidly fast forwarded that, and we're getting to a point now where we're going to be able to look back and say, if it wasn't for COVID, if it wasn't for 2020's pandemic, a lot of these things that we enjoy now, freedoms and better health in 2025 and 2030, are going to be because of what we had to accept and start to use as far as technologies and monitoring and personalizing and making the access to the doctors better, all of that, right?
Yeah, look, I think if I was President Biden, the first thing I would do is create a 9/11 commission for healthcare, because the problem becomes it's easy to rubber band back because there's a lot of corporate interests and a lot of money to go back to the old system, right?
Yeah.
I mean, telehealth is already going down because some insurers are saying I'll pay the doctor $250 for an in-person visit. I'll only pay him $49 for a telehealth visit.
Wow.
The government said you can't do that during COVID for obvious reasons. So, as long as I'm making money by having sick people come to my hospital, as long as the insurers get paid 17 cents on the dollar to make sure the people that pay for the care, get the care, and provide the care can't talk to each other, so they can send out 27-page things and say, this is not a bill. As long as pharma is getting retail from CMS, as long as, dermatologists and orthopedists are making 15 times what primary care docs are making, but we tell the primary care docs we want to be the quarterback. As long as that happens, the folks in the system are not incented to change everything. So, if you think about 9/11, we love the ability to be able to run through the airport and get there in 8 minutes.
Right.
And when 9/11 happened, the Democrats blamed the Republicans, Republicans blamed the Democrats. At some point, they got together and said, you know what? We failed to keep the country safe. So what needs to happen now is we have to say, Democrats and Republicans, we failed to give everybody access to healthcare. And all we've done with the Affordable Care Act and some of these other things is give more people access to this broken, fragmented, expensive, and inequitable system. Philadelphia has 6 academic medical centers, Chris. We have the greatest discrepancy in life expectancy, 5 miles on either side of the Rocky Statue.
Wow.
It's because, and by the way, that's not something we just figured out. In 1966, Dr. Martin Luther King in Philadelphia said, of all the forms of social injustice, healthcare inequities are the most shocking and inhumane.
Wow.
And we haven't done any better in 54 years. In fact, if you want a multiple choice test, say in Philadelphia, your greatest chance of getting COVID and dying from it were A, wearing a mask, B, social distancing, 3, your genetic code, or D, your zip code. The answer would be your zip code.
Wow.
Because, do you have broadband? Do you have the right food? Do you have education? Do you have appropriate housing? That's really what matters. if you haven't eaten the right food and you're obese and you've got congestive heart failure and you don't have the right heating and you don't have broadband, your kids aren't getting educated, you can't do telehealth, and by the time you show up to the hospital, the chances are you're going to need a ventilator and die. If you're a Caucasian person that lives in the suburbs and you're on all Jeff Connect and you're checking everything out in Google and you eat healthy and you do get COVID and your telehealth person tells you exactly what to do, your chances of getting out of it and leaving the hospital are 5 times greater than that first person. That shouldn't happen in the United States. And the way to get out of that is to literally democratize it like other industries have done. People can shop easier, they can travel easier. Even the iPhone has democratized finance for people. Things like Vanguard made it easy for somebody who has $10 to save to be able to buy a stock. Those are the kind of things where digital changes literally help everybody. And that's what we're excited about in healthcare. How can I get rid of food deserts? Think about food deserts, right? I can walk to a Trader Joe's and a Whole Foods in my zip code. There's certain zip codes in Philadelphia that the only thing they can walk to is a bodega selling like corn chips and soda. But what if you said, if you're willing to serve your family healthy food, we'll give you 30% more government electronic food transfers. And what if we drone delivered that food or Instacarted that food? You know what? No more food deserts. So I'm passionate about how do we use technology that exists today to disrupt the way that we provide healthcare.
Amazing. And you're doing that and you're leading the way in that regard. And there's so much more to what you're doing than what we've been able to scratch the surface on here today. But this is, to me, very inspiring that there are a lot of people and there's a lot of healthcare systems like yours that are really looking at the future in a way where it's going to be a much better place for us all to live. We're all going to be healthier. We're all going to know our status. There's not going to be things we find out it's too late, and we're going to be able to better monitor ourselves going forward, thanks to people like you and technologies.
Yeah, I'd sort of leave you with this. In the beginning of our book on healthcare, A Manifesto for Health Insurance, we say, what if a Silicon Valley entrepreneur and a CEO of a traditional academic medical center walked into a bar, got married, and had a kid? What would that look like? And that's sort of what we're talking about. And the other thing we say in that book is, by definition, disruption is painful for those who don't want to change. So, I used the Sears and Penny's example before. I always tell people, I want to be Target and Walmart. Because when Amazon disrupted that industry, Chris, Sears and Penny said, boy, what a stupid fad. We're just going to make stores. Things like Circuit City said, oh my God, we got to go all E. Well, they couldn't compete with Amazon. Target and Walmart said, hey, we're really good at what we do, but we also have to compete in this world. To me, if somebody, God forbid, has pancreatic cancer, we're one of the top places in the country. I need my hospitals and I need my surgeons to do what traditional academic medical centers do. That's never going to be E. But if somebody's got a chronic condition or somebody's got diabetes, I want them to be able to access Jefferson as a person, not a patient, the same way they can access Amazon or Airbnb.
And not wait until it's too late when they're actually sick to have to then go in. They'll know they're heading in a sick direction first before that happens.
Right. Exactly right.
Amazing. Well, thank you, man, for your time. Thank you for everything you do. And, it seems to me like with people like you in our healthcare system, really making decisions and deciding to innovate and disrupt, that the future of healthcare is a good place. And 10 years from now in 2030, like you envision, it's going to be a much better place to be. So I'm really looking forward to getting there with you.
Thanks. Well, if I was a really good futurist, when I did your first podcast, I would have talked about beware of the pandemic. So, I don't get it all right.
You get a lot of it right. Thanks so much, Stephen. Have a wonderful day, and God bless you and all your people working for you out there.
Thank you. Thank you, Chris.
Take care.